And for ophthalmologists, the major risk of pseudotumor cerebri is losing your vision because it causes swelling of the optic nerve, and that swelling we call papilledema. So many drugs that are hormonal based or anti-hormonal based have been reported to cause pseudotumor cerebri, and so it's no surprise that these agents are associated with pseudotumor cerebri.
Well, hello, everybody. Welcome to Our Watch. I am Tim Thompson, and we've got a very hot topic to talk about today. The FDA has come out now talking about the puberty blockers that are being given to children and the fact that some of the kids that are on this are experiencing brain swelling and permanent vision loss. And here to talk to us today about this is a medical doctor, Dr. Andrew Lee. He is the Herb and Jean Lyman Centennial Chair in Ophthalmology, also a professor of ophthalmology, neurology, neurosurgery at Weill Cornell Medicine. So, Dr. Lee, thank you so much for being with us today.
Happy to be here. Thanks for inviting me.
Of course. We have this topic of children being on puberty blockers. Of course, this is a hot topic. It's much debated in our country. We have you on the program today not to debate whether or not children should be on that, but just to talk about the findings of these studies, the statement that came out from the FDA, and what your medical professional opinion is on these puberty blockers. We talk about the fact that they've identified this serious potential side effect for some of these children that are on it. Can you talk about these side effects for us?
Yeah, so as a neuro-ophthalmologist, my job is brain and eye, and in this particular case, the eye nerve. And so pseudotumor means that it acts like a tumor, but it's not a tumor. So pseudo means false, and tumor is like a brain tumor, but this is in your head, cerebri. And so medications can cause increased intracranial pressure, and that high pressure in your head can mimic the symptoms of a real tumor. And that disorder we call pseudotumor cerebri. And for ophthalmologists, the major risk of pseudotumor cerebri is losing your vision because it causes swelling of the optic nerve, and that swelling we call papilledema. So many drugs that are hormonal based or anti-hormonal based have been reported to cause pseudotumor cerebri, and so it's no surprise that these agents are associated with pseudotumor cerebri.
So we look at these drugs that are causing this, and we're looking at the study talking about how there's 5 to 12-year-old kids. These are children that are put on these things pre-puberty to stop puberty, and now they're experiencing some of these side effects. The type of the pseudotumor cerebri, what you were talking about. I'm concerned because I look at what these drugs are used for besides this. I mean, really, it's an off-label use. Using it for gender dysphoria, it's an off-label use. They've used these drugs for chemical castration and sex offenders and various other things. So why would somebody, what is the purpose of this drug?
So if you block the puberty, you're blocking the normal physiologic process that would occur as the child ages. So these drugs are anti-hormonal by their nature, and I think that there's risk to these kinds of treatments, just like there's risk with any medical treatment, however.
Sure.
And the anti-hormonal activity is thought to be the mechanism of the pseudotumor cerebri.
Yeah, you talk about risks, and I appreciate that. I'm in the state of California. One of the things we're watching a large push for, and again, you're not here to debate whether or not these are something we should be doing with children. That's not you're just talking about the actual medical side of this. But in California, what they're trying to do is create what they call wellness centers on school campus where kids can have access to these puberty blockers. And one of the things that these proponents of the puberty blockers are saying, this is like their main push for this. They're saying they're safe, they're effective, and they're completely reversible. Now, is that statement accurate? Are these drugs safe for the kids? Are they effective, and can you reverse what they do?
So in terms of the side effect that we're talking about, pseudotumor cerebri, obviously that's a known side effect of many drugs in the same class, and all drugs have risks. So all drugs are inherently have some safety profile. And so this pseudotumor cerebri is one of those risks. And so you can make a drug safer, but you really can't make it 100% safe. There is no 100% safe drug for anything. And in this case, although pseudotumor cerebri might be reversible if you de-challenge, is what we call it, which is stop the agent, some patients do not respond to removing the drug with the de-challenge, and they continue to have vision loss from pseudotumor cerebri. So in terms of safety, there's a risk profile that you have to take into account. And this particular side effect, pseudotumor cerebri, could potentially blind you, and it may not be reversible. Some of those patients have irreversible blindness.
Yeah, I look at some of the other things that we're seeing, some of these other side effects, stunting the height, the growth of the children, impairing their bone mass density, having an adverse impact on cognitive functioning in the children, IQ levels dropping, sterilizing these children and making it so that way they're never able to achieve an orgasm. I hear those things, and I mean, as a parent, as a grandparent now, for me, I hear this and it just scares me that kids would have access to these things, especially without parents' knowledge or consent. But these types of things, I'm hearing those are irreversible, especially the sterilization of a child. Is that something that you can speak to, or are you familiar with whether or not it's going to sterilize a child for life?
So probably those kinds of questions are outside my normal area of expertise and not in my wheelhouse. However, all side effects are potentially irreversible. And for the one we're talking about, pseudotumor cerebri, it can definitely be a problem. So there definitely has to be a risk benefit. There have to be clear indications for using any drug, and there has to be a clear discussion about those side effects weighed against the benefits in any medication, but especially in these agents because they're being used in children.
Yeah, it's being used in children. So just to be clear, what you're saying is it's not safe. In fact, you'd said earlier that they're not safe. You just make them safer. Can you speak to that?
Yeah. So as with any drug side effect, we can limit and make drugs safer for specific side effects. If it's dose related, we would reduce the dose. If it's not dose related, we can just stop the drug. And by establishing clear drug prescribing indications, we can make it safer. So in the regular type of pseudotumor cerebri, which is caused by obesity and is called idiopathic intracranial hypertension, there's a higher risk profile for females who are obese. So that'd be a profile of a type of patient who might have a higher risk from being exposed to these type of agents, but it can occur in either males or females and is independent of weight sometimes.
Okay. Well, hey, Dr. Lee, I really appreciate your time, your insight, your medical professional opinion on these things. And, we're hoping just to educate the public and make sure they know what's going on before they see these types of things introduced to our community. So thank you. Really appreciate you being on with us today.
You're welcome.
All right. We'll see you guys next time right here on Our Watch. Don't forget to subscribe, like, and share this out with your friends, your family, your neighbors. God bless you.